Sure, that makes a lot of sense. So the first question is, how can I fall asleep and stay asleep? I recommend really take a look at an oral type of administration, which is a capsule or an edible. Get that 8 to 10 hours of coverage, which is really important. And really to help kick that off might be something that relates to the inhalation or a sublingual drop to really kick that process off, because it could take an hour to 2 hours for that to kick in as far as the oral treatment is concerned.
I have actually had some consumer feedback. So normally we would say use a vape or an inhalant to fall asleep, but before you fall asleep, take that ingestible to stay asleep. I've had a couple of consumers come back and say, well, you know what, Manny, I knew what time I kind of wanted to go to sleep. So I took it about an hour to 2 hours before then. And then if it wasn't quite kicking in yet, then I would inhale something to help me fall asleep. And it almost assuredly kicked in while I was asleep. So sometimes taking it a little bit before might be beneficial, and it's not yet kicked in when you want to go to sleep. Use that inhalant. You won't overdose on it. It's completely safe, and that way you have that longevity. But journal it, take notes, make sure you're writing down what you're using, when you're using it, the dosage you're using, so you can be repetitious in that. And if it's not successful, we can help you on a consultation with those notes.
Sure, that's great. Next question that comes up is, since this appears to be at least somewhat sponsored by Surterra Wellness, how do I know that this isn't an infomercial for them? Well, first of all, I want to answer this directly. This webinar series, Medical Marijuana and Wellness, my objective is to bring the best possible people, representatives, doctors, professionals on the program, on the show, to be able to provide you the best information that's out there. You'll notice that Dr. Greg Holt is on the program tonight. He's a sleep specialist. Manny is one of the people that I know that has worked with numbers of patients in a consultation standpoint, and has a great bedside manner as well as the knowledge to be able to help people answer a lot of questions. So yes, Surterra is the one who does help sponsor this, but this isn't an infomercial. This is really, the whole program is designed to really help you get your life back. And I think that's really something that I really want to emphasize. Yes, we do talk about Surterra products as an example, mainly because I don't want to, how should I say, upset a lot of different people, but meaning different other dispensaries, because I don't want to use products that really may or may not be suited for what they want to talk about. But I do want to drive home the fact that there are products that can work. That's why, for example, Manny mentioned the terpenes. No matter which dispensary you go to, ask for those terpenes and ask for the products that are with those terpenes. It'll really help you with the really that's out there. Now, one other question that does come up, and I think Dr. Holt is with us, or should be with us very quickly, but it says, does cannabis affect the quality of REM sleep? I don't know if Greg has been able to log in or not yet. Greg, are you there?
Yes.
Great. Can cannabis affect the quality of REM?
Yes. Yeah, absolutely. The molecule resembles a tricyclic amines, and it can delay REM onset, and it can decrease the amount of REM sleep or dream state sleep most people think of. It's one of the things to think about. People will notice it that use medical marijuana. If they stop using medical marijuana or take a drug holiday, they can see a return of REM sleep. They can notice an increase of dream state sleep for the next 3 days, 3 nights.
Great, cool. Next question is, I am a side sleeper and have intense hip and IT band pain while lying in bed only. Any suggestions? Greg, your thoughts on this?
Well, pain management is a big thing. That's something you can check in with primary care physicians or a pain management specialist. But body position during sleep with some of these quality pillows that are out there is a big thing. If you're a side sleeper, it may be because it's not your choice. It's because that you don't breathe that well supine or on your back. And it could be suggestive of some type of obstructive sleep apnea or REM-dependent sleep apnea. You should get that checked out. And then, there are medications, other medications, including medical marijuana, that can reduce the inflammation associated with it.
Right, that's good. Thank you for that information. Next question is, does THC and CBD have a negative or contradicting effect if the person is undergoing cancer treatment? And I suspect when they say cancer treatment, they're talking about either radiation or chemotherapy. Greg, what's your thoughts on this?
Well, don't do it without consulting the physicians. For one, they want to know everything that's going into your body if you're undergoing chemotherapy or radiation therapy. So they have to know everything. So if there's something that they say that's okay because of weight loss or something like that, or other problems, pain, they can get into that with you. But especially if you're part of some kind of like a cancer therapy study, you have to be upfront with them and say what's going on, because things may not go well. So I think it's important to share all information with the Western medicine.
Right. I know that a lot of folks use cannabis, THC and CBD, with cancer treatment in order to overcome the effects of the chemotherapy and the radiation, to help them get their sleep, to help them get their appetite back. That is something that has been worked. I wouldn't say it has a negative or a contradicting effect, but it is something that can have an effect. And that's really where getting your doctor involved is really an important part of doing that. Let me jump to the next question, which product will last the longest for a good night's sleep, tincture and capsule? I think we kind of answered that with talking about the capsules and the edibles, the gummies, the brownies, chocolates. Manny, what's your thoughts on that?
So it would actually depend. So Surterra has both the sublingual, and we also have Theragels, which are slightly different than the capsules. And the reason I mentioned that, if you take a sublingual, a tincture, if you will, and you hold it under the tongue long enough, you're going to get rapid absorption through the mucosis under your tongue, and it should last about 4 to 6 hours depending on the dosage. Whereas if you take a capsule, you won't get that onset for somewhere between 1 to 2.5 hours, depending on your diet and time of day and environment. And it also depends if you're going to get any terpenes with that capsule. The reason I mentioned our Theragels is because our Theragels are designed to actually be broken down, the capsule itself, in the gut, but absorb, or in the stomach, and then absorbed in the gut. So you're actually getting those terpenes in about 90% of bioavailability, which makes it last about 7 to 10 hours. So all depends on which dispensary you're getting that product from, what is the carrier of that tincture, if it's alcohol-based or oil-based. But typically, if you ingest a capsule, since it's going through the first pass effect, converting to 11-hydroxy, you're typically going to get a longer and more efficient effect that way than you would through a tincture.
Sure, I think that's a good explanation. I tend to recommend oral products, the capsules and the edibles, if you want to take a look at a complete night's sleep. Let's see. It says, I'm new to medical marijuana. Where do I start to manage use and dose effectively? First, I want to mention that if you're in Central Florida, we're going to be doing a seminar on the 27th of February in the Villages on this particular subject. So please join us. It'll be something. Manny, you're going to join me for that, right?
I will be.
Yeah, and so it's a live seminar. It's at the Waterfront Inn. But if you're really new, we also have a online in our video library, a webinar on how to get started with medical cannabis, and that's something to really take a look at. But Manny, if a patient walks into your dispensary and asks you this question, what's your answer?
Well, we would ask quite a few questions to find out what the situation is, their tolerance, if they're new, if they have a particular route of administration they would like to use, or otherwise. But then we also have that information on our website. Like, if you don't have your card, or if you're brand new and you want to formulate questions to be informed before coming in, you could go to our website, surterra.com, and find out information like that as well. But it's always start low, go slow. If you're new, we usually recommend inhalants to start, because it's fast in, fast out, meaning if you don't like that effect, it won't stay with you long, as where if you were to ingest something, it can stay with you for 6 to 8 hours. But typically somewhere between 5 milligrams to 10 milligrams starting, as 7 to 12 milligrams is the average for any given person.
Sure. Now, next question comes in, which is important. How much sleep can I get from smoking? And I think you answered that earlier when you mentioned when you mentioned vaping. Why don't you give us that answer again? Like quick in, quick out, right?
Yep, whether you're smoking, vaping, any inhalant, since it's such a rapid effect, you get that oxygen and chemical exchange within the lungs within seconds, gets in the bloodstream fully within about 5 to 7 minutes, but it also dissipates very quickly. That's delta 9 THC as opposed to 11-hydroxy when you ingest it. So you can go to sleep from smoking. If you have trouble staying asleep, though, it may not necessarily be beneficial to smoke before, or at least add an ingestible to it.
Yeah, typically, the duration for smoking, especially smoking cannabis, is usually about 2 to 4 hours.
And that also depends on your tolerance. It depends on your diet. It depends on how much fluids you intake. There's a lot of variables that go into it.
Yeah, that's something.
Underlying disease conditions and other medications.
Oh, that's a good point, Greg. That's a really good point. You have any other comments on that, Greg?
No, I agree with everything that Manny is saying, but keep in mind that there could be a lot of other things that are going on that could affect like the quality of your sleep even after you go to sleep. So that's the big thing to consider. Is like you're coming into the whole idea of medical marijuana with the idea of poor sleep, but have you looked at everything that could be going wrong with sleep before you start medical marijuana?
Sure, that's a good point. That's a very good point. This next question, I don't know quite how to answer this. So it says, I was using a full spectrum vape with 50% CBD called Stupor, and it's not available at any near me anymore. Where can I get it? Manny, are you familiar with this?
Yeah, so a 50% vape card Super Glue was actually the strain name. Super Glue is a hybrid one-to-one vape card. So one part CBD, one part THC, which lean more indica-like based on the terpene. So it was relaxing and it was great to help you go to sleep naturally. We haven't done away with it. We will have it back in stock depending on your location. We're just going through some new maneuvers and making sure we can get the best quality out. Because again, that is a formulation. We want to make sure that we keep it consistent. We wouldn't want to put out another super glue that wasn't quite a 50-50 or one-to-one, or didn't have the right terpenes in it that gave you that same effect.
Right. Now, I've used that and I found it to be very effective. I think one of the things that people don't realize is that cannabis is a botanical. It's got to be grown. And the real issue is when you're dealing with plants, you want to make sure that when you buy the product, no matter where your product and where you get it and which dispensary, that you have the consistency in the product that's out there. And that's always the challenge. And I think that's what's going on with it right now. It's just the timing. It has to do with not necessarily the manufacturer. Sometimes it has to do with the seasons and the weather and things like that. So a lot of things to take into effect. Over here.
There are two alternatives. There's a one-to-one flaming cherries, which is actually better for the daytime. And there's the one-to-one soothe in a disposable vape that you might find comparable to the one-to-one super glue.
Sure, great. Next question is, are there any other over-the-counter sleep aids, melatonin, Benadryl, that should not be used with your products? Greg, do you want to take that question?
Yeah, anything that like reduces anxiety or can be considered a hypnotic, you have to question if you want to do that polypharmacy kind of thing. So Ambien, Sonata, all of those kind of medications that are GABA inhibitors, I would be careful with in combination drug therapy with something else. So that's something to watch out for.
Yeah, that's something there. Thank you. Next question is a really good one. Is there any way to get medical marijuana approved for use as a patient to stay in a hospital? I've been told no, but you've mentioned working with your doctor on it. I had a left knee replacement and I used medical marijuana post-surgery to be able to reduce my pain. Now, in the hospital, they had a hard and fast rule: no medical marijuana, no marijuana at all. And when I talked to my doctor, he said, look, just don't tempt fate. It's just going to be too difficult for us to do that. And since I was operated on Monday and I got out of the hospital on Wednesday, I did use pharma drugs Monday and Tuesday. Wednesday, I took nothing, by the way. And until I got out of the hospital about midday. And then we went into the parking lot and I actually used a tincture drop to start with and then a vape pen. And literally when I took a couple hits out of the vape pen, by the time we went my wife was driving, when we got from the parking lot from the garage to the street, the pain was down to a level of 1. I would say work with your doctor. Ask him. I don't think your doctor is going to be able to get these hospitals to be able to approve it. They have a standard of care that cannabis isn't part of, and they're worried about lawsuits and financials. Greg, your thoughts on that? I don't think they're going to let you do that, right?
Not a chance. Yeah.
Okay.
Any outside medications, they don't care if it's aspirin from the outside. They want to control all medications while you're an inpatient.
Yeah. Wish I had a better answer. Don't shoot the messenger. But that's unfortunately, until we get this rescheduled to schedule some other schedule, and we get more research done here in the United States, I don't think that's going to be something that's part of the cards. Now, I do empathize with you because I used medical cannabis post-surgical knee post-surgery, and I was with 5 other patients. 4 of them used pharma drugs. I used medical cannabis. My pain level was lower than theirs. In fact, after about 6 weeks, 2 of the pharma patients converted over to medical cannabis because their pain level wasn't lower than mine and they had negative side effects. So all I'm trying to point out is that unfortunately we're stuck in this cycle, and letting your politicians know that you are in favor of medical cannabis can't hurt. One of the other questions that now comes up is I have a low tolerance. Most times I've tried it for sleep, and it has instead kept me awake. I'm 70. Manny, you want to take this one? Because I think this has to do with dosing.
Yeah, I'd be happy to. So I would first have to find out what products were being used and which route of administration was being used. But typically in this instance, considering the age, is probably a sublingual or an edible. And more than likely, you're taking a microdose, which is probably 2.5 to 5 milligrams. Now, depending on the product, if it's not terpene infused and it's basically just THC, or if you're ingesting it too fast before it absorbs sublingually, that microdose of THC can actually have an uplifting effect. So you would definitely want to hold whatever you're taking. If it's a sublingual or a gummy, I suggest on chewing the gummy, actually suck on the gummy, let it absorb sublingually before ingesting it, and keeping it there a little bit longer, and you might have a better effect. And I would go up as high as 5 milligrams to start, not just the 2.5 milligrams, if that's what it is. Also, keep in mind, if you're near a Surterra or any dispensary for that matter, we're all required to have a consultation room per state law. So you can come in and ask those questions, and we could take our time and figure out what is actually going to work or why something is not working for you.
One of the most important things is you have what they call COAs. This is a COA is what is in the product. And so I think that it's important to look at the COA to find out if the product has terpenes in it, because there's a lot of dispensaries that sell products that have no terpenes in it, meaning you're getting straight THC, and that's not necessarily going to help you sleep through the night. Manny,
not only
the COA?
Yeah, absolutely. The certificate of analysis will show you that. But let's be devil's advocate and say you have a product that does have terpenes in it. Keep in mind, like I said with the gummies, if you chew them too fast and swallow them, terpenes are the most volatile molecule on the product, so they're destroyed instantly when they hit that stomach acid. So now you're just getting the cannabinoids, the THC and CBD, without anybody behind the steering wheel. So that's why we suggest holding the tincture or the gummy within the mucosis of the mouth for as long as you can tolerate, at least 45 seconds to get that absorption. But to those COAs, you can see what terpenes, and then we can show you which products are going to be beneficial.
Yeah, and I have to tell you, I'm a senior citizen as well, and I pay a lot of attention to the terpenes. I've tried products that are basically THC only, and they don't work for me, at least not for sleeping. I agree with him. But when I take a look at the right terpene profile, it makes a huge difference to help me get some sleep. Next question is, can your body get used to certain dosages and then stop working, making you have to up dosages again and again? I think this is related to a question is, I'm currently using RSO oil, an indica gummy, and 5 milligrams of melatonin, and it's not helping me sleep. Any tips? Manny, this has to do with taking a holiday. The question people have that you've got to take more and more cannabis to have it work. And that's really the negative of a lot of pharma drugs. But in our particular case in cannabis, you can take a cannabis holiday. I think this has something to do with it. Why don't you explain that concept?
Sure, I call them tolerance breaks or tea breaks, or holidays. And before I jump into that part of it, one of the things I would recommend if you're currently using this many products is use just the RSO, up the dose on that, and make sure you have something fatty or mix it with something fatty, since you cannot inhale RSO or FSO oil, Rick Simpson oil, or full spectrum oil. You can only ingest it or use it topically. And the reason I mention that is because cannabis, again, is a fatty molecule and needs something fatty to attach to. And if you just take it on an empty stomach, it will be beneficial, but then you might get what we call a second wave when you eat or consume something later down the line. So I would definitely, and you don't want to go to bed on a full stomach. So maybe a little cup of yogurt, a spoon of peanut butter or something when you take your product, and you might find it more efficient that way. Otherwise, if not, then that's when the tea break or the tolerance break or holiday comes into play. And usually you go about 3 to 4 days, some depending on your tolerance, no pun intended. And you can use CBD to help bridge that gap as well. But first, the first day is usually cold turkey, if you will. You're not taking any products. And then the second day, you start implementing some CBD, which reprimes your receptors within your system to receive that THC again. And then when you start back up, I wouldn't necessarily start with the RSO oil again. I probably start with something a little bit more subtle, like a distillate or an edible, like the gummy or such, to see how that affects you and work your way back up.
Right. And I'm going to point out again, there are a number of products that are on the market. Some of the dispensaries are selling tinctures that have no terpenes in them. In fact, I tend to filter out those dispensaries, not use them in my webinars, because I think the terpenes are really the key to medical marijuana. And really, you're not trying to just get high. But I think it's important to look at that COA, stick at that certificate of analysis, and make sure that the terpenes are there. And then if they are there, take that break. I know I take a break every 4 to 6 weeks. Now you're supposed to take a break 2 to 3 days. I get about a day to a day and a half, and unfortunately, my injury, I have 7 herniated discs. After about a day to a day and a half, my neck taps on me on the shoulder and says, you better do something pretty quick or you're going to know I'm here. So I think that break is really, really important. It's personalized to every person that's really there. Let's look at the next question. Can too much THC in a sleep tincture make me anxious instead of sleepy? Manny, your thoughts?
Absolutely. So marijuana is biphasic. Almost like alcohol, you drink too much, or you drink just the right amount, you're feeling nice, you drink too much, you're hugging that porcelain, and then that's never beneficial. So definitely, you got to find that sweet spot. Low and slow, titrate up about 2.5 milligrams at a time. If you're ingesting it, I would do it every 2 to 2.5 hours. If you're inhaling it, maybe every hour, depending. However, yes, too much THC can make you anxious, particularly if it's with certain terpenes. If you're using a terpene like limonene and pinene at nighttime, that's definitely going to make you anxious. That's equivalent to taking an energy drink and then trying to go to bed. It just doesn't work out too well. So
Sure.
I would restart your doses low and slow.
Yeah, pay attention to those terpenes. One of the next question, which when I don't really know how to answer, maybe Greg can help here. Can a medical marijuana clinic request my medical records from jail? Greg, do you know if that can happen?
I have absolutely no idea.
Yeah, I don't know. I mean, I have to tell you, I really don't know. I don't want to give you some information that's wrong. I would say the best thing to do is let them try it. It's the best way of putting it. All they can say is no, right?
The last clinic I worked at, Mark, we did put in a request out of state and we did receive it. So it's just like putting a request to any other clinic. Sometimes there's fees included, sometimes there's not. And then you got to sign off on the waiver saying that you released that information. But the one time I did attempt it 2 or 3 years ago, it did come through.
Okay. Well, that's a good answer. Good. Thank you, Manny, for that input. Next question, Greg, this might be up your alley. I've tried Ambien and Tylenol PM, but the only thing that works is cannabis. Why?
Part of it, I think, is going to be psychological, that you believe that it'll work before you try it. Now, Ambien and Tylenol PM, 2 different medications, 2 different mechanisms of action, but both Ambien and Tylenol PM and medical marijuana are supposed to push you over the edge if you're ready to go to sleep. That means that sufficient sleep pressure built up, and on the backside of the circadian phase where you're ready to go to sleep. All 3 of them will work. Now, why one works more than other, you can say that somebody's, system is tuned up to be more responsive to cannabis, but that's hard to say. That's an individual response.
Yeah, I think this goes back to dosing. Every person's body is different. And the thing about, especially with cannabis, is what ratios work for one person doesn't necessarily work for another. And so it really has to do with your body. It's a very personalized thing. And this might fall into that personalized category. Your thoughts, Manny, on this?
I would completely agree. A lot of the times we mentioned that pharmacopoeia or pharmaceuticals play in a different playground than cannabis. Cannabis is more like our natural internal medicine cabinet, equivalent to the anandamide and 2-AG and the other receptors. However, I am by no means a medical professional, so that's just conjecture and based off of consumer feedback.
Sure, that's great. Greg, this might be a question you can help us with. Can medical marijuana cause jaw clenching and teeth grinding while I sleep? I think the question is, what causes that to happen when you sleep, and can medical marijuana cause it or relieve it?
Yeah, bruxism or teeth grinding happens in deep sleep or in the first third of the night. And jaw clenching, they believe it's related to anxiety that could be happening during the day, or even like some underlying pathology of sleep during the night, like obstructive sleep apnea. But the dentist can usually identify both of those. And if they tell you that, you know, the go-to medication is benzodiazepines in clinical world, a Valium-like medication to like stop both of those kind of things. But, you know, that could be definitely like psychological and physically addictive, and it could have like consequences if you're on it for a long period of time and try to come off of it. So I haven't seen reports that medical marijuana are any better or less effective than the benzodiazepines that they use.
That's great. Good answer. Good question. Let's take a look at the next question here. Julie asked, and these are questions from the live that we've been answering live that's here. Can fibromyalgia be added to a lack of sleep? Greg, can fibromyalgia affect sleep?
Yes, but I've never seen it in like thousands of sleep studies and brainwave activity. I've never seen it cause the problems like chronic pain from, say, like intractable cancer or something like that can cause. But fibromyalgia is real, but I just don't see how it like causes the problems that I could see on EEG during sleep. But so I know it will if it's been diagnosed, but I just don't see it.
It's good. Good answer. We showed a chart in the beginning about the length of sleep time that's needed. The question is, what about ages 19 through 24? How much sleep should somebody in that age group be getting?
Well, you know, you still go back to that short sleeper, long sleeper kind of idea, and the idea of the average of 8. But young people still need that same kind of things. You know, they just transition to where they're in the middle of that. 8 hours of sleep is what we think is standard for most people. Less than 4 is a terrible idea, and more than 12 is a terrible idea. And try to figure out what's going on if you need to. But I think between 19 and 24 is still that 8 hours of sleep.
Okay, thank you. Chris asked a question that says, I attended the anxiety and stress webinar on January 10th. Chris, thank you very much. Both you and Manny mentioned certain terpenes and or terpene combinations that can cause short-term memory loss. Please explain the terpenes and their combinations that cause that side effect, and also provide a link to the Penn State resource that Manny mentioned. I want to mention that the resource is there on the screen, and we'll include it after this webinar. You'll be getting an email that'll give you a copy of the Q&A as well as the videos that you can look on YouTube to access a copy of the presentation, and then also this link will be in there. But Manny, do you want to take this question about the combination of terpenes? I guess they're talking more about anxiety and stress.
Yeah, I'd be glad to. So I don't quite recall the terpenes that can cause short-term memory loss issues. It was more of a terpene or terpene combinations that can rekindle short-term memory when you're dealing with PTS or anxiety and stress. And those terpenes were limonene and pinene, particularly combined, or pinene in abundance by itself can kind of bring back that short-term memory and have you re-experience things during PTS that you may not be ready to face. As far as short-term memory loss, I haven't come across any studies just yet that have any concluded evidence that shows what terpenes or combinations or cannabinoids that cause that. However, my personal experience, I noticed that when I kind of overuse a little bit too much of my heavy THC products, that I started noticing I'm having issues with short-term memory, and it subsides, it goes away, it's not lasting, it's not dangerous, at least not in my aspect, and there's no studies showing that just yet. But if I do find any, Chris, and if you want to stay in contact with this webinar, Marijuana Aware, or reach out to Surterra, we'd be happy to see if we can follow back on that for you.
Sure. Sure, I think that's important. My biggest problem with memory loss is my age, not necessarily cannabis. I wish I could blame it on cannabis. Let's put it that way. Dan asked a good question. I got an alarming email from FLA about the passage of HB 1269 to tremendously limit the amounts of THC products that is sold to the lowest level in the United States. We can't get through to our state reps. What else can we do? Well, first of all, I want to mention the best thing you can do, and we'll include a link. Call the people that are trying to push this bill through and tell them that you don't want that to happen. There's a phone-in campaign that's going on right now that really to make this happen. Every year, the people that are anti-medical cannabis bring this THC cap issue up. And it has to do with a faction of, candidly, our politicians in Tallahassee that listen to the lobbyists rather than listening to the people. And that's the best way of putting it. This is wrong. Let the doctors choose the medicines that they need to be able to help the patients. Politicians should keep their paws out of the medicine cabinet. It's the best way of putting it. But on the other side of the coin, the best thing we can do right now is just literally light up the answering systems of these representatives and let them know you're against it. And then more importantly, let other people know. Unfortunately, we go through this every year, and I don't know. I'm just dumbfounded that they would do this, but I'm not surprised. Manny, your thoughts?
My experience on this is something similar to my experience when I was in Vegas, in Nevada. So when I went there, they didn't reciprocate that I have, or my medical marijuana card from Florida. However, because I had a medical marijuana card, I was subject to less taxes and no THC caps. So I'm reading a little bit into this. I'm presuming that this has to go, if it is passed where it's rec, then the rec part of it will be limited. However, if you hold a medical marijuana card, there won't be limits and less taxes, kind of equivalent to what other states are doing that are rec. However, I personally do not agree with it. I don't think that should be allowed. And to your point, Mark, reach out. I'm going to be hitting that link once you post it up as well.
Yeah, I think it's something we just got to let people know. I think what they're probably also doing is because the rec petition got put on the ballot. The Supreme Court here in Florida allowed it to go on the ballot, which was against what DeSantis and a lot of the politicians in Tallahassee wanted. I think they're probably trying to do this to really set the stage to neuter recreational marijuana. But look, the point is stand up, let them know, and let's go from there. Now let's move on to another question that she can answer. What about THC and CBN? CBN is great. I think it works. It works great. Manny, you want to comment on that, because both of these are great for sleep.
Yeah, and CBN is actually very, very good for sleep. It's not as euphoric as Delta 9 or 11 hydroxy THC. However, it's hard to come by, and that's because of the process of making it. And it's becoming more popular and more readily available. And the part that I want to share with everybody is that CBN is actually the degradation of THC. I don't like to say degradation because it sounds bad. I like to say it converts from THC to CBN the longer you sit or the more it's exposed to sunlight and other variables. But they do say it's a degradation into CBN before it actually goes really sour or bad, gets that mold, mildew, or jar rot. But yes, CBN, if you're kind of reluctant on THC, is a great way to start because it's subtle, it's not as euphoric, and it works very, very well to help you sleep from the consumer reports I've gotten back.
Sure, and it's now you carry CBN, right?
We do not just yet.
Okay, but I'm sorry, I heard that you were going to be carrying it. But the point is, CBN does work. The question is, it's hard to produce. That's why a lot of people don't have it. And I know you're going to be producing it, but it's something that really, really does work and something to pay attention to. And the last question that came in here is, does THC have detrimental effect on memory? Your thoughts on it, Manny?
Again, it's on person to person. I know it's not lasting if you do have any short-term memory effects. I haven't seen any reports, any studies that came and said that you're going to suffer memory loss and that's it, you're done. So I would say no. not detrimental effects, but it can have effect on your short-term memory, which does subside.
Right.
Yeah, I agree.
Greg, you got some comments on this?
Short-term memory effects, yes. Is it like long lasting? No.
Okay, good. Have you seen that in your sleep studies at all?
No studies that I've seen. It's like anecdotal evidence,
Right.
with somebody on marijuana or medical marijuana will forget stuff. Yes.
Right. Well, I think having a Schedule I drug, it's hard to do the studies here in the United States. I know that hopefully when we get this rescheduled, we'll be able to do some studies and really answer that question definitively. But Greg, thank you for that answer. Mike asked the question is, do oils have a shelf life? Do tincture oils have a shelf life?
Actually, all oils, tincture oils, vape oils, or otherwise, do have a shelf life. As we did just mention, THC does convert into CBN. And if you're dealing with those oils, I tell people, particularly the ones that do shopping on sales and they buy really big in bulk, tincture oils, you can have a longer shelf life, probably 6 to 7 months. If you keep it in a cool, dry area out of direct sunlight. Your vape oils, I wouldn't keep more than about 45 days. You'll notice, particularly if you keep them in above room temperature or in direct sunlight, it'll start turning really brown and then eventually black. That's possibly that conversion along with other contaminants that can build up in there because now it's exposed to your lips, your mouth, your breath, the regular air. So I wouldn't vape anything or inhale anything that starts turning brown or non-translucent. But typically around your tincture oils, around 6 months, your vapes and otherwise, probably about 45 days to 60 days.
Sure, great. Well, I think we answered all the questions that are there, that have been out there. Maybe we should wrap this up. I do want to point out that if you're going to be getting started with medical cannabis, we're actually going to be doing that webinar, as I mentioned, at the Villages, and it'll be on the 27th of February. Next week, we have a we didn't really announce it, but we brought it out today, and we're going to be announcing and promoting it. We're doing a webinar next Wednesday on February 7th on intimacy and cannabis. So it's something that you may want to tune in for. It's a kind of a new topic and should be interesting. It's got a lot of good information. But I do want to point out that if you're looking to get a medical marijuana card, we have the MMTC, Medical Marijuana Treatment Clinics of Florida. There are 22 clinics throughout Florida that can help you get a card. They're very experienced, and there's a lot of benefits that you get from using this particular firm as a doctor rather than other doctors. So please take a look at it. I want to mention, if you're looking at it for products, we do recommend Surterra. We're not just pushing Surterra by itself. We recommend any Florida-based and certified medical marijuana dispensary, of which I'm particularly favorable towards Surterra, primarily because a lot of your tinctures have terpenes in them. And I think, Manny, you can confirm that you're very focused on terpenes in your product line.
Absolutely. That's one of the things that we pride ourselves at Surterra is that though we're not medical professionals, we do like to consider ourselves subject matter experts, if not somewhat clinical.
Sure. And My Botanical Wellness will help you if you're looking for CBD products. The problem with CBD products is they're unregulated. So in many cases, you're looking at products that aren't tested. And I think that's always dangerous to put things in your body. Lastly, I want to point out, we have the YouTube channel, Marijuana Aware Patient Education, growing YouTube channel. We put all of our videos, we put all of our information out there. If you have a medical condition or you're looking for use or something like that, medical cannabis can help quite a bit. So there's some resources for you. And we'll include that in the email. So thank you very much. We appreciate you, and join us next week. It should be an interesting webinar.